Hey everyone, Dr. Charlie Johnson, physical therapist here. Short video to talk to you about what could be going on if you have pain when you're standing or when you're walking, so when you're upright, or if you're sitting in a really tall posture. We've always been taught, right, to sit up really tall. Sometimes that can actually be a bad thing for some people, believe it or not. And also, perhaps you have pain when you're lying flat on your back. If you're this person, maybe if you're laying flat on your back, you may notice that there's a big arch in your back. You may just notice that if you look in the mirror, you have a big arch in your back. And here again is what could be going on. So picture this little diagram as if you're looking from my right side on in. You'll see that my back is like excessively arched, right? And my pelvis is kind of tilted forward. Picture my pelvis like a bucket of water. It's almost like I'm pouring the water out the front, right? And it kind of causes an arch in the lower back. Think about the bones in the lower back as sort of like a stack of blocks, okay? You know, in this example, all the weight and the compression is sort of on this side of the tower, right? So if we're in a standing position, a walking position where our back is excessively arched, okay, we can sometimes put too much pressure on these areas, and they get sensitive to that pressure and they cause pain, okay? Also, nerves travel out, right, around these pinch points, which can cause compression of those nerves and cause pain, numbness, tingling down the leg. If you're older, this often leads to a diagnosis of spinal stenosis, okay? So if you're watching this and you have spinal stenosis, this recommendation or these things could help you as well. So the goal is, again, if you're in an arch position, it's simply don't do that, okay? So what we're trying to get you to do, okay, is we're trying to get you into a position where the blocks are more aligned and you're not so arched. You're actually, by tightening your belly, you're actually creating better alignment in the spine, which is not causing compression in the spine, okay? So what we see, there's three big things that we see that need to happen in people who have pain when they're standing or walking for the most of the time, okay? What we see is that, let me explain this really quick. We have an excessive arch in the back, okay? So we have shortness of the muscles in the back, okay? I'm gonna sneeze. Caught that on camera, cool. Didn't sneeze, so it'll come in a minute. But then we have excessive length of the muscles in the front, okay? So if these muscles are short and kind of taut, okay, these muscles are sort of stretched out, okay? And they don't function all that well, all right? Because they can't counteract that arching effect. And then sort of the hidden muscle from below, here's the hip muscle, okay? And here's the pelvis, you're facing this way. Is there's actually a muscle, your hip flexors, that attach from all the bones in the lower back, okay, to the hip. So they're constantly tilting that bucket or that pelvis even further forward, causing an excessive arch in the lower back, okay? So if you want to fix pain with standing and walking, you need to think about three things, okay? And I'll create another video probably showing you how to do these things, okay? I'll be off the screen here, but bear with me. Number one, you need to lengthen back muscles. Okay, so this line here needs to get longer, right? Otherwise, you're never going to be able to get out of that. You need to kind of lengthen it so you can sort of open up the spaces in your back, okay? Number two, you need to strengthen abdominals, right? Because if you can strengthen abdominals, you can sort of pull this down, kind of tilt the bucket back a little bit, okay? Which relieves pressure back here. And number three, if these are taut, your hip flexors are taut and they're causing sort of that tilt forward, what you need to do is you need to lengthen hip flexors. Okay, so a cue for right now, like a take-home is, hopefully you understand that, all right? A take-home for you is if you have pain when you're standing or you're walking, okay? First thing to try is go put your back against a wall, okay? You may notice that if you put your back against the wall, put your feet out about like half a foot, okay? You may notice that you naturally have an arch in your lower back, meaning there's a window where you can actually stick your hand back there, okay? What I want you to try to do if you're feeling it at that moment is I want you to try to tighten the belly and flatten your back against the wall. Okay, once you get good at flattening your back against the wall, holding it there maybe 10, 15, 20 seconds, as long as you can, okay, try to kind of come off the wall and hold that flat back position and try to move, okay? Test it out. It's easier said than done. Again, a short-term strategy, but I'll give you some techniques as to how to do these things, okay? So if you're having pain standing and walking, you need help, this makes sense, but you want to get there quicker, email charliejohnsondpt@gmail.com and I'll get back to you, or comment below. Thanks.